Greetings from Krishna IVF Clinic and the Krishna IVF channel, the channel where we share unbiased, evidence based information for the benefit of the patients. In today's episode, I'll be speaking about what are the variations that happen in an IVF process. The variations can be broadly divided into patient specific, clinic specific. In patient specific, they're again divided into age specific, diagnosis specific. Let's talk about age. Age makes a major outcome. A person with 40 years age might have a different protocol compared to a woman at 30 years. So your protocol depends on the clinician's planned treatment. Similarly, the goal is to get optimum number of eggs and not to get too many eggs. Whereas when it comes to diagnostic specific protocols, for example, if the woman has polycystic ovary, the common preferred protocol is an antagon protocol. Whereas if the woman has less number of eggs, they might go for short protocol, antagon protocol, or a long protocol. And similarly, endometriosis, they might go for a GnRH protocol. So protocols might depend on the diagnosis the patient has. When it comes to clinic specific, they're broadly divided into what is the common protocol the clinic follows, what is the transfer policy the clinic follows, whether it's day 3 or day 5, what is the type of luteal support the clinic gives in. Fourth is, do they add-on procedures like assisted hatching or MC procedures. The fifth is, a few times they might suggest pre-implantation genetic testing. Let's start with the beginning. Protocols, if it is a polycystic ovary, some clinics choose antagon protocol, some clinics choose long protocol, but it also depends on the patient's conditions. When it comes to the timing of embryo transfer and the number of embryos that are transferred, a lot of clinics have moved to day 4 or day 5 transfers. Some clinics do day 3 transfer. But on the whole world is moving to 2 embryo transfer, and in some selected countries they are moving into a single embryo transfer. The third is fresh transfer, freeze-all transfer. It is a debatable which is the best, and ultimately the evidence is divided. Both are equally efficient. So one should decide on the clinic's preferences and give the choice to the clinician because that person is the best judge. When it comes to luteal support, some people give vaginal progesterone, some people give vaginal tablets, some people give oral tablets, few people give injections, and some clinics give a combination of these two things. This vary from clinic to clinic. The next thing is genetic testing. Not every IVF cycle needs genetic testing called the pre-implantation genetic testing. In selected situations, they need the genetic testing. And what is about add-on procedures? There are a lot of procedures called add-on procedures called assisted hatching, sperm selection methods like MC, poloscope. All these are dependent on individual circumstances. Overall, we have discussed that variations can happen based on the patient's profile, based on the clinic's profile, and the technology and the experience. Hope you have understood, and in future videos we'll be elaborating the details of each of these. Have a wonderful day with all of us from Krishna IVF Clinic and Krishna IVF channel.